So if you've been listening to Mastering Midlife, you will remember a guest a little while ago named Allison Garner. Allison talked to us about her supporting her children who were both having a lot of mental illness challenges. Her daughter attempting to take her life and her son's substance abuse. And it was a gut-wrenching, heart-wrenching conversation. After the conversation, I actually had to sit down and have a good cry. The dad in me just, had broken heart. And as I told Allison, I work with so many people. This is not an isolated thing. I work with so many people. A lot of my clients have children who have challenges. More people than you know are dealing with children with mental illness. And a lot of them, a lot of you don't talk about it. So you don't know that you're not alone. So I asked Allison if she could help me find some resources. And she did. She found our next guest for me. I'm going to read you something that's on the front page of her website that just moved me to tears again. You are exactly the right person to advocate for your struggling child, but sometimes it can feel impossible to know exactly what to do. The options can seem overwhelming. Pilcrow Advisors and therapeutic and educational consulting practices are here to help. God, I can't even get through that without crying. Jamie Goodman is a placement consultant. She works with people who have children who are challenged with mental illness and don't know what to do. She spends her life traveling around the country, finding places, boarding schools, all kinds of facilities that help. Jamie is here today to talk to us and maybe offer a little advice. Jamie, thank you for being here.
Thanks for having me, Mark.
I didn't go over all of your certifications and all your advanced degrees and all that stuff because I'm just having trouble holding it together. Just reading what's just going to your website, which I'm going to put in the show notes, just breaks my heart open. So thank you for what you do and thank you for being here.
Thanks for having me. I'll just give a quick introduction of myself and a little bit of a background. I'm a therapist, but I don't practice as a therapist. I'm a full-time placement consultant, and typically families come to me when they feel like they've exhausted options locally. Many families whose children have mental health and substance abuse issues have been through, hospitalization, PHP, IOP, a dozen outpatient therapists, and they really just don't know where to turn. That's my most typical client. And of course, I work with clients who happen upon me sooner in their child's process. And so maybe they don't have all of those treatment failures in there, but people are seeking out something different when they're coming to me.
How did you get into this? Like what brought you in this direction?
Well, I was always in the helping profession. I was a camp director and thought that's what I would do for a career, and went to college, was all set, and decided right after I graduated that I wasn't done with school. And so I went and got my master's in school counseling and community counseling. And then I worked for 5 years on the south side of Chicago in an elementary school. And that's really where I honed my crisis management skills. My first year, I was taking everything home with me and in tears every night, just feeling so helpless. And in order to survive, I quickly learned how to turn it on and give it my all, but then go home and turn it off and be present at home. And so I was able to make it 5 years. And it was around that time that I started having kids and was looking to do something where I could be in it more long-term. And I wasn't just looking to put out fires and then, have the next one erupt the next day and put that one out. And that's what it felt like in the public school system I was in. And so I shifted to therapeutic and educational consulting about 8 years ago now, and just haven't looked back, and, have tried on a couple of different specialties within placement consulting, but really have gravitated towards working with those who are struggling, as opposed to those just looking for an enhancement or, a program that can specialize in a certain extracurricular activity. I really like working with struggling kids and young adults. My youngest client's 9 and my oldest client's 28. So, within that age range, there's quite a bit of variety. But I get to partner with families and then be involved long-term and see them at their lowest point. And for many of them, get to see them a year later reaping all the rewards of their hard work, and getting the right intervention.
So help me normalize. The thing that teared me up about what you put on the front of your page, and I even asked this to Allison. I did it kind of confrontationally because I knew she could handle it, and I knew it would be something valuable for other people. Is that you are the right person for your kid? So many people think I did this to my kid. This is my fault, and they get so wrapped up in the subjective that they can't get objective to figure out what needs to happen. How do you help people, like when they call you, they're not in a great place when you talk to people? Like you're not having like, hey, how are you? Sun shining today. People call you at their absolute worst, probably a lot.
Yeah, a couple things in common when people call. They are feeling very hopeless, which makes sense because nothing has worked. And so this is just, calling me is just checking off another box of something else that's going to fail. So I see it as my job to provide some hope, and that can come through in a lot of different ways. Sometimes it's connecting them with programs that just seem like the right fit. Sometimes it's just hearing them out. Sometimes it's connecting them with other parents who have been in their shoes, who are either right in the thick of it or who have come out the other side and are in a better place. And sometimes it's connecting them with parents who they have done everything they can. They've gotten them all the intervention possible, and still the outcome is the same. Just to really begin educating them about what is out there and what could be. A lot of families who come to me don't know anything beyond the insurance-based treatment options that are available. And they're very short-term in nature. They're very driven on once you stabilize, you're out. And so you're never really in it long enough to see the positive impact. And then the other quality that most parents come to me with is a ton of shame.
Yeah.
They're carrying, the burdens of their child. They are struggling with feeling guilty or not doing enough or not, intervening soon enough or whatever it may be. And the bottom line is that the parents who are calling me are actually the ones who have provided more intervention than your average parent, of course. And so normalizing their experience and helping them to see that they are not alone. And it's really important to go and do your own work during this time. And, when your child enters treatment, you're also entering, the whole family is entering. So really encouraging them to get their support if they don't have any.
So when you say do your own work, it's not your fault. You didn't do this, but you're in a family that has mental illness. You're in a family that has dysfunction. You're in a family that has these challenges. So going and doing your own work is putting the oxygen mask on yourself, figuring out where you are in the equation. It's not guilt. It's not fault. It's not anything, but you have to be able to be at your best to be able to help the other person in the family.
Absolutely. And a lot of times mental health issues, what comes along with that is family systems issues, right? Someone's mental illness has impacted the family system, and whether you're treating that child with kid gloves because you're just so fearful, or whether you're, laying down the hammer because you think that intervention is going to work.
And the impact on the siblings, like how are they dealing with this?
The family trauma that everybody is exposed to is significant and needs to be addressed and needs to be worked on in order for things to change long term.
Put in perspective for me the tip of the iceberg thing. Again, I cannot tell you how. Maybe it's because of what I do for a living, or that people actually tell me what's going on in their families. But I can't tell you how many people are challenged with this. How prevalent is this versus what we see on Facebook and Instagram?
Mental health issues are everywhere. 1 in 4 adolescents struggles with diagnosable mental health issues.
1 in 4, 25%.
25%. And my guess is it's a little bit higher than that, right? But those are clients kind of coming in being diagnosed. It is everywhere. And whether it is depression, I am seeing a tremendous amount of anxiety, both from children and their parents as well. I think part of that is also caught up in tech use. seeing significant social challenges. Half of my clients are young adults who have, done pretty well throughout middle school and high school. And then when they're left to their own devices and go off to college with very little structure, they just totally fall apart. And then, of course, substance abuse. The pot of today is not the pot that existed when we were
I
kids.
keep saying that it is not like a lot of the parents are saying, what's the big deal? They're smoking a joint or this and that. I'm like, it is not the same thing.
The potency in marijuana today is causing significant challenges for adolescents, especially those with developing brains, but
Mm.
also young adults. And we're even seeing drug-induced psychosis from marijuana, which we weren't seeing, or at least it wasn't documented years and years ago. And we think it's because of the potency of the drugs available. And then, of course, you've got, you think you're smoking pot and it's really laced with other things and all of those other complicating factors. But it's a lot for adolescents and children to take on these days.
So you spoke a couple minutes ago about insurance-based avenues, right?
Uh-huh.
And maybe state-funded or federally funded avenues versus what else is available. Can you talk about that dilemma and what people are facing in that little rat's nest?
Yeah. I'll give you just an outline of all of the services
I know
available.
we don't have 6 hours and a slideshow.
I'll keep it short. So essentially there's insurance-based treatment, and it really, the level of support you receive is really determined by what you qualify for per your insurance company. And so there's hospitalization, highest level of care. There's residential treatment, which is typically 30 to 45 days, oftentimes 14 days, whatever gets approved. And then there's PHP, which is partial hospitalization, where you are in treatment all day long and you go home and sleep. And then there's IOP and outpatient therapy. So there's all of those levels of care. But what people don't know is that there are also private pay options, which are really dictated by what is it that that child needs, not what is insurance willing to cover. And sometimes insurance can have an impact, but a lot of times families need to go into this understanding that there is a private pay component that you really have to be prepared to face and pay for upfront, and follow through with if you don't get any insurance reimbursement. And that really opens the doors up to longer term therapeutic boarding schools where you're not just taking care of the tip of the iceberg. You're really able to get under what's underneath and see children in relationships and provide them with skills and let them practice them in a real life environment. There's wilderness therapy programs. There's assessment centers. There's long-term residential treatment centers. There's this whole world out there that is just truly dictated by what is in the best interest of that child. And a lot of times these programs are longer term in nature because we know that a couple weeks of intervention isn't going to be enough to make a lasting impact.
Right. What are people doing to be able to find the money to do this?
So we're fortunate in some states that a school district could be held responsible for funding a placement. So for families that can't necessarily afford it out of pocket, that's one avenue I encourage families to pursue. And a lot of times you have to get a special needs attorney involved to make that happen. There are programs that are a little bit more insurance friendly where we can get some insurance coverage for the beginning portion of the program before a client is stabilized. So sometimes we turn there. I have families using, 529 funds and reaching out to.
So I had a 529 for my kid to go to college. I could use those funds if they're 13 or 15 years old and they need something like this. I can use those funds for that.
Potentially, it needs to be converted into another fund. So that's a better question for the accountant. But absolutely, that's one avenue to pursue. I have families taking out second mortgages. I have families asking for loans from friends. There are also financing companies. There's lots of different routes to pursue, but the bottom line is private pay treatment is expensive. It can range anywhere between $5,000 a month and $30,000 a month, depending on the level of care that we're looking at for the child.
And just how are the results when if someone actually does that and goes that extra mile and mortgages their house and they put $200,000 into this thing? Uh, what kind of odds are they giving their kid?
So it's variable, right? We're dealing with mental illness, and the outcome we're expecting for someone who is schizophrenic is going to be a little different from the
Sure.
outcome we are expecting from someone who has some underlying depression. Those who follow through with not only placement, but follow through until completion of treatment and follow treatment recommendations for continued care after that. So, outpatient therapy, family coaching, all of these other services, results look pretty good. I track my own statistics within my organization. 95% of my clients who enter into contract with me are following through until program completion. And I think that's because a lot of times we're weeding out clients who aren't super committed, who can't afford what I have to offer, who
So what you're saying is everybody has to be committed. It's got to be the parents. It's got to be the kid. It's got to be. It's like you're trying to find people who are actually going to pick up an oar when they can.
The parents in particular, a lot of times families will come to me and the child isn't even aware that I'm involved for safety reasons. If the child was super committed and willing to do whatever and could think rationally and could make these decisions for themselves, a lot of times they're not a candidate for me.
Mm.
Of course, I get those kids who are anxious and depressed and want help, but I also work with kids who are so spun out or so overwhelmed or using substances or acting out sexually or whatever it can be that they can't be part of the process of figuring out what's going to be the solution. And so a lot of times we're doing that work behind the scenes, working with parents, working with mental health professionals to really identify what the best route is going to be. And then the process of either onboarding them or safely transporting them to treatment just varies client to client.
Mm. So what if you don't have any money?
Those are the worst calls. I face them every day. A lot of times, hospitals and hospital social workers in particular are good resources. Again, like I said, school districts. There is
That's a
some.
surprise. That's a surprising one to me that school districts are responsible to help. But, again, I feel for the school administrators and things who are trying to figure out budgets. But if I'm needing help for my kid, I'm going to exploit every avenue I can. So if I can get a lawyer a special needs lawyer, which I didn't even know there was one, to help with that, I would totally go down that avenue.
And again, it depends on the state. Illinois is pretty good at funding. California, New York, New Jersey, pretty good at funding. Wisconsin, terrible. And
Hmm.
sometimes in Wisconsin, it's left up to the county. But we try and get creative. There's a couple of scholarship funds out there for people who don't have resources. Sky's the Limit Fund is one of them. And that is for families who wouldn't be able to afford wilderness therapy on their own. Essentially, they apply, they're issued a grant, and then a wilderness therapy program who's partnered with Sky's the Limit will match that grant. So I'm working on one of those cases now, and we're opening up the ability to go to wilderness from a financial standpoint for a family that wouldn't otherwise be able to consider it.
What kind of organizations are there for people who just need to get in touch with other parents, just find out that they're not alone? Like where would you set, where would I send people?
People can always call me and I'll connect you with a parent. I don't
Uh,
want parents feeling alone. I know Allison's always willing to talk with parents. There's a couple of really popular Facebook groups these days, which I can send over to you for parents who
because I'd like to put in the links
yep,
of this podcast, just places for people who are sitting there going, I don't have money, I don't know what I'm supposed to do, but where can I go so I can actually talk to people, like an Al-Anon or an AA meeting? Like,
yep.
where can I go talk to people who are in the same boat as I am?
There's some pretty amazing online communities, especially now given COVID. Connecting online is important, and then parents, will connect offline and set up calls. And there's some virtual support groups going on. So I will send you a whole list of resources.
Thank you. I appreciate that.
Sure.
So what am I missing? What am I missing that we could share with parents who potentially have this challenge?
No, I think really just educating people that there is more out there than perhaps your outpatient therapist knows about, or the school social worker, or the hospital social worker. I think we are so used to staying within that box of what we know of, that hospitalization, PHP,
Mm,
IOP, individual therapy circle. And until you happen upon someone who has been in your shoes, or you are fortunate enough to connect with a psychiatrist who knows about alternative interventions, parents always call me, and their first statement is, "How come I'm just finding out about your services?" Or "How come I've never heard of wilderness therapy before?" Or just so frustrated that these concepts, these options have not been presented previously. So I think the biggest message is help is out there. There are about 100 of me throughout the country, and so
really?
we're called. We have a couple of professional organizations. I'm happy to send you links so you can find someone who's a really good fit for your family. But when you're going to invest this type of money in these types of interventions, it's really wise to have someone guiding you.
If you were on the other end, if I was distraught and you were on the other end of the phone, the way you present yourself, the way you speak, there are people who just have that groundedness that are
Mhm.
comforting. And I feel that from you. And I appreciate that you use your gifts in this way.
Thanks so much, Mark.
Um, yeah, this is again, uh, I'm at a loss because I feel like this is the tip of the iceberg of what I could possibly do with this forum to get this kind of information out there. And you just opened up a bunch of doors. So if you're listening to the podcast, go to the show notes. I will make meticulous notes of where you can go, what you can do, and how you can get in touch with Jamie. We're using Allison as a bit of an avatar. An affluent, highly educated, highly caring parent who was, just like you said, didn't know what was available, didn't know how to find what was available to help her kid. And that kind of broke open this conversation. So thank you for doing this.
Yep, and happy to connect you to just so many other resources out there, whatever would be helpful to any of your listeners.
Thank you. I'm hoping. I hate the thought of it, but think your phone will ring off the hook from this. So thank you. Is there anything else that you need to share? Is there anything cool that you have going on that you want to advertise to the thousands of people who will be listening to you?
Nothing that cool. For the first time in 10 years, I'm kind of on lockdown here in the Chicago area. So I've been doing backyard consultations with families who are local, but half my clients aren't local and never
Mm.
have been. So we're talking via Zoom. But certainly you can check out kind of my Instagram and my Facebook page and get a sense of just all that's out there. When I'm touring, I'm taking photos, I'm sharing
Mm.
options with families. So certainly parents can look up Hillcrow Advisors and take a look.
All right, let's go. Let's get all that in the show notes so that
Yep.
nobody has to write anything down. Thank you, Jamie. Thank you. You jumped right at this, and I just appreciate it.
Thanks, Mark.
To everybody else, really thank you for listening. If you know someone who will benefit from this conversation, I'll put in the show notes Allison's conversation, this conversation. Please share it with them. Please share the resources that we have and I really appreciate it. Take care of yourself, drink water, be kind to yourself. I love you. Have a great rest of the day.